Good afternoon, ladies and gentlemen. This is the last topic of the today's session, and in fact, the last session of the conference. What is next in the diabetes research? Before we begin our discussion, we'd like to give some background. So each of us, the panelists, will show some slides. So the topic that I'm going to discuss about is computational design. How computational protein design can help design new drugs for diabetes. So the title is kind of a code to cure. Basically, AI is a buzzword nowadays. So how AI can help us designing new drugs for diabetes. That is the main discussion. But the AI has many applications. Like there is a lot of data which is there in clinical trials, as well as with the patient, a lot of patient data, real-time data. So with that, we can definitely use AI in the diagnostics as well as early detection of diabetes. Second, it can be used, like there are many wearable devices that each one of us is using, wherein glucose can be continuously monitored. Thus, AI can be used to manage the healthcare of the diabetic patient. And third thing that we can use is designing new drugs for the diabetes. How that I will get into the next slide. So diabetes, the word definitely doesn't need introduction to any one of us. It affects millions of people. And how computational protein design can be used in the diabetes research, that is what I'm going to talk about. So before that, we need to understand what is computational protein design. So computational protein design uses computer algorithms and softwares to design new proteins with specific functions. Mainly molecular modeling, molecular dynamics, these kind of algorithms are used for designing new proteins. Obviously, as with each of technology, computational protein design has its own limitations, wherein it has been limited with the accuracy for the protein modeling, as well as with complexity of designing the large proteins. So naturally, if you see, proteins are made up of all L amino acids. So, but and with that limitation, proteins are only found in two shapes, like alpha helical structures as well as beta sheets. But if you introduce D amino acid, which is an unnatural amino acid in the protein structure, then there is a possibility of diversifying these fold structures. And we have a couple of examples wherein we introduced D amino acid into a natural protein or a small protein peptide, and we designed a smallest heterochiral blue fluorescent protein using the state-of-the-art protein design software called IDEAS. So the next step is to use such kind of algorithms in designing new kind of molecules like insulin mimetics, incretin mimetics, so that they are more stable than insulin, have a longer duration of action, as well as protease stable. So that is what we will be discussing in our panel. So I'll hand it over to Trishala.
Yes, thank you so much. I had images here. Okay, great. So I think, thank you Ranjit for letting us know about AI and diabetes. That's like the most researched and searched topic on Google, actually. So to rewind a bit, what is diabetes? So diabetes is a word. In a medical school, we know that it means high blood sugars, but that's not it. There's a lot more to diabetes. And when we're talking about the latest research, on 9th of June 2023, ICMR, it's the Indian guideline, it came up with the research paper where it says that now 100 billion plus people have diabetes. And about 36% of them also have hypertension. So while we are constantly researching about what to do with diabetes, we have to rewind a bit and see how we can prevent diabetes. So the research should be more on the prevention side as well. So you see this whole chart behind me and in front of me. This is data regarding my patient that I have been working on with. So I will just show you his photograph. That's my real client. So he came to me about, we worked on a 6-month diabetes reversal program. So diabetes reversal is not a fad. It is possible. And we will quickly come to the point of how we can do it, etc. But I just wanted to share with you about what happened with my client. So he's 46 years old. He was close to 160 kilograms. 49.4 was the BMI, had hypertension, pretty much everything. His HbA1c was 14.7%. So that was on 3 drugs, plus he was taking insulin. And he's just 46. So when he came to me, he's like, I'm dying. Please save me. I've tried to go to all doctors. I have tried to do everything possible. It's not working. Please help me. So his blood sugar was close to 475 post-food, despite taking insulin, despite taking 3 drugs. We had exhausted the diabetes list. There's nothing left now that we could prescribe. I told him that we should work at the root. That's what is missing. He said, even if you ask me to go upside down, I will do it. So we actually started working on the 6 months diabetes reversal program, in which I don't do any supplements. There's no additional meal replacements, etc. I purely focus on lifestyle. Nutrition, sleep, stress, exercise, intermittent fasting. That's what I work on. I did the same with this gentleman, and this is his before-after photo. In 6 months, he actually came down to 95 kilos from 160 kilos. His HbA1c was 6.7 on only 1 drug. The 475 came down to 145. So I couldn't believe it myself, honestly, that this has actually happened, and what I'm doing is working. But when I thought what I did with him, it was just the basics. So somebody told me that, oh, he's young. That's why he's able to do it. Once you have diabetes for, say, 50 plus years, you won't be able to do anything about it. So my next example is of a woman who's actually 75 years old. And she's been having diabetes for 35 years. I'm sorry, it's 35 years. Kidney gone, heart gone, weight gone, everything is just done, okay? Her weight was close to 110 kilos, and she told me, she called me up, and she said that doctors have told me that I'll have to go on dialysis, either today or tomorrow. So is there a chance of doing anything? Because I've been reading what you're doing. I told her that we can start working on it. And not even 6 months, it's just 3 months. She came from this to this. But the most exciting part was her HbA1c came down from 16.3% to 7.1%. And she's only taking 500 milligrams of metformin. Everything just worked for her, and her nephrologist said that you don't need any dialysis. Your creatinine is fine, you're doing fine. So somebody who's 75 years old could actually do it. So if we just work on the basics, I don't think it's a major rocket science, and it's just possible, okay? So I just wanted to share that the newest thing in diabetes research is reversal. So if you work on it religiously, you can do it. Okay.
So, as we know, we have basically 2 types of diabetes. So I will talk about the type 2 diabetes conditions. Which one is associated with the fake sensitive insulin, or from the destruction of the beta cells? We don't have this protein. So for this case, a specific case, we can use the stem cells therapy. It's the one new kind of treatment for the diabetes, which one is in the preclinical trials. So the motivation of the studies about type 2 diabetes therapy is create the world without the diabetes and improve the quality of life to the patients. It's the most important because how is the recommended to the patients to change your lifestyles. It's not too much easy, even because the type 2 diabetes patient, it's mostly it's little bit older. So to them to change their lifestyle, it's not too much easy. So if we have some treatment, it can improve the quality of life to the patients, and we can offer this one to them. It could be amazing. So for this one, the stem cells treatment comes to help them. So when the immune cells attack the beta cells into pancreas, they destroy the beta cells, causing the inflammation reaction, and the pancreas stops to produce the insulin, how we know. So for the treatment, this condition, the stem cells can fix what is wrong into the immune systems, but we have to understand which stem cells are using in this therapy. So in the body, we have the many kind of stem cells. Actually, each tissue there is your own stem cells, but these cells come from the first from the embryonic stem cells, and then these cells changing a little bit, and it's became adult stem cells. In the last group, these groups can be shifting the ectoderm, mesoderm, and endoderm layers, and these are multipotent stem cells and can be used for the stem cell therapy, including the umbilical cord and placenta stem cells. So for that, how I said yesterday, Dr. Neil Jordan described many clinical evidence for the use of the stem cells, can be for the several diseases, including the degenerative disease and the autoimmune disease as type 2 diabetes. So how the stem cell therapy works for the type 2 diabetes is when we offer the stem cells by IV method, when these cells go first to the heart and start to looking for the issues, inflammations, and they start to healing process and manage the construction side. They can identify what's the problem with the cells in the body, and can manage by the construction side everything which one is wrong with these cells. So after these cells come to the heart, they come to the lungs, where 70 or 80% getting stuck in the has to go to the regenerative repair, take care of the inflammations and other issues on the body. But these cells, which one stay stuck in the lungs, it's even better than in the immune system, because when the cells pass by the lung tissue, the stem cells, the mesenchymal stem cells, which we delivered by IV, they can interaction with the cells which pass by the bloodstream, and what they do for the immune cells is for whatever reason, can tell to these cells if they are working right or wrong. So the communication between the cells are from the cytokines and the signaling proteins. So when these signal proteins hit the cells and say that B cells or killer cells or T cells, all the immune cells, and get in the uploading a new software. It's like how the stem cells could identify what is wrong with the cells of the body, why these immune cells are killing the beta cells in the pancreas, and like fix what is wrong with the cells, like one uploading software. So now the immune cells is stopping to attack the pancreas and start to protect how it will be should. Then it can help the blood sugar back to the normal range. Even for the complication of diabetes, the stem cells therapy can help. Even for the wounds or the another complications that can affect the quality of life of the patients, the stem cells can improve and can help the patients get back to the normal range of the blood sugar. We have many cases which when the patients come and took one shot of the stem cells, it's around 300 billion stem cells delivered by IV, and around 3 months after, the patient related to come back to the normal range of the blood sugar. So the stem cells can help the patients even to stop to taking the medicines or the control of the insulin in the several cases. Not in all the cases, but we are talking about the type 2 diabetes, not the type 1. In the type 1, the stem cells can release the situation of the patient and make the blood sugar a little bit low, but cannot fix everything how in the type 2 diabetes, because in the type 1, it's from the genetic problem, so the genetic error. So the stem cells cannot do any modifications in the genetic conditions. Just can manage the construction side and correct the errors of the cells which one are attacking, for example, the beta cells.
Yeah, thank you. So as you mentioned, like stem cells work mainly using paracrine effect, right? So what is the current status of the stem cell therapy? Like, are there any approved therapy for diabetes?
Actually, while there have been promising finds in preclinical and early clinical trials, there is currently no approved stem cell therapy for diabetes because it's yet in the early clinical trials. But many clinics and many countries around the world are using this kind of treatment for the diabetes or the another disease. For example, in Mexican, it's approved there, but in USA, for example, it's just in the clinical trials.
Yeah, like stem cell is one of the thrust area for US FDA as well. So which type of stem cells can be useful in diabetes?
Actually, all mesenchymal stem cells can be used for the diabetes treatment, but there is many tissues where we can get these cells we can get from the fat tissue, and it's the most tissue they are using for get the cells, and because that is, we can isolate too much cells, and we can isolate this in the easy way. But the good mesenchymal stem cells, the most good mesenchymal stem cells we can use, it's from umbilical cord or placenta, because this kind of stem cells is more young and don't have an issue from the time of the life of the patient, because the problem is when you remove the stem cells from the fat tissue, there is a little bit delay about the growing and the multiplicated of these cells because of the age of the cells. But when you use like stem cells from the umbilical cord, we can get billion cells from the ones tissue, and they can multiplicate it very fast. So the basic difference between them is this, but all the mesenchymal stem cells can be used to the treatment, this kind of treatment.
Okay. Now from this cutting edge therapy of the stem cells, we'll switch gear to lifestyle changes. So Trishala, could you please explain diabetes reversal and what it entails?
So diabetes reversal, if we talk by the books, is when your HbA1c levels are below 5.7. And if your fasting blood glucose is below 120 and post-food below 140 mg per dl, we say that the person has reversed their diabetes completely. So diabetes reversal is nothing permanent, right? So for example, if you just broke your phone, you will give it for repair, it will be fine. But if you drop it again, the phone will break again. So if you go back to the same lifestyle that gave you diabetes, you will eventually go back to having the same amount of diabetes. So it's nothing permanent. It is what you have to keep working on.
And what are the key factors that contribute to the development of type 2 diabetes?
Oh, multiple. So we already had like a big list. We had nutrition, high carb diet, protein deficiency, poor sleep. It's not about how many hours of sleep do you get, it's about the quality of the sleep. So that, lack of exercise, and constantly being stressed, producing excessive cortisol, and now COVID has added on to the factors. So the amount of diabetes cases I'm seeing post-COVID is enormous.
Yeah, and is there any subgroup of diabetic patients which is harder to reverse the diabetes?
Absolutely. So whoever is not working on the lifestyle, that's definitely number one. But anybody who has recent diagnosis of diabetes, so when I say recent, in the last maybe less than 5 years, it is a lot easy for them to reverse their diabetes versus somebody who has it for the last 10, 15, 20 years. Because their body has become so insulin resistant that they pretty much don't respond to any changes, be it medications, be it lifestyle. So it takes a lot of time. And the most important factor that plays here is the blood test that lets us know if your diabetes is reversible or not. So it's not like anybody who's walking in my clinic, I will just look at their face and say, hey, your diabetes can be reversed. No. There is a blood test called as fasting C-peptide. That blood test, it's a regular blood test. That blood test lets us know that whether your pancreas are functioning enough to support you in your diabetes reversal journey. So if the C-peptide is in the range, great. If it is touching below, like in the lower normal of the range, reversing your diabetes can be really difficult. And if it's, obviously, if it's less than whatever the range is, that means it's not really possible for you to get out of diabetes as such, but definitely if you can work on the basics, you will be able to have better control over your sugars. I have seen miracle cases happening. I've seen people's C-peptide also improving. So I will not put a blanket statement here that, no, it's not possible. I think it depends case to case.
Okay, thank you. So we'd like to have some questions from the audience.
Can't hear you, sir. We can't hear you.
You can hear me.
Now we can.
Now, yes, now. You said about the reversal program, which is well known actually, and most of the physicians are using it for the time being. Your reversal program for diabetes. I mean, what I was saying that it is a good program and it is well known, and most of the physicians and endocrinologists, they are using it. But what about if the patient is non-compliant? Have you experienced with the other two medications which are now being a new trend now, like Mounjaro and like Ozempic? Have you experienced with them? Are you giving them? Other than the pancreatitis, have you faced any other problem with these medications? To which category of patients you would recommend these medications, please?
That's an excellent question, sir. And I don't believe patients are non-compliant. I believe that patients don't have enough information, and that's the reason why they are non-compliant, because they don't know what to do. So if somebody is coming to me with diabetes for 20 years, all they were taught is, it's one medication, 2, 3, 4 insulin, and that's the end. You have to live with this for the rest of your life. But what if I tell them that if you work on this, your medications will come down, your cost of medications will come down, and you will feel better. So I'm not saying that your lifespan will increase, but whatever life you have on this planet Earth, at least we can definitely work on improving that. So non-compliance doesn't fit my dictionary, one. The second thing is, there are many cases where we have to use the drugs to support the lifestyle changes that they are working on. So say if somebody is really trying hard, working on the food, working on sleep, pretty much all the boxes are checked, then what? So if we don't support with all these drugs that's coming up, it can be a bit of a problem. So I always like to do a blend of both, but my first preference is always going to be the easy way out. The second is to explain them that these are the possibilities, this is what exists, these are the list of side effects. Are you ready to go ahead with this? If yes, I'm happy to prescribe it. If not, we have to see what we can change, what we can work on your current routine. And there are some cases that are just, they don't just respond at all. It's not because of them, it's because of the insulin resistance that's caused by the medications given by doctors like us. So it's not their fault, but I happily prescribe the Ozempic whenever required. And it's a very short term, so it starts helping them with whatever they're doing, and then definitely have a plan to take them off it. So I hope that answers your question, sir. Thank you so much. Any other questions? Yeah.
It's not a question. I'm sorry. Yes, thank you so much for that. It's not a question, but it's a validation. There's no really such thing as non-compliance. It's about connection and making them understand what if they will not do this, or understand the procedure, or what is good is benefit to them if they will follow. Yeah. It's about proper connection between the physician or the doctor to the patient. If they understand, when they feel safe to your knowledge and expertise,
Absolutely.
They will follow,
Absolutely, and if they're still not, I've tried my best, okay? If it still doesn't work, there's definitely some emotions going on there. So how about addressing their emotional health, which is equally important? Maybe they might have lost their closed ones to diabetes. Maybe they have seen people get worse when they go to doctors or when they listen to their advisors. So it's important to just give them a minute to talk. Just sit back, listen, without just being a prescriptive doctor. I think if we just give that 1 minute to the patients, just listen to what they're saying, the entire non-compliance is out of the window. And that's what I have practiced, I have seen in the last 10 years. So I will not call any one of them non-compliant. I love them all. Any other questions from the audience? Okay, great. So I think...
Yeah, so I'll thank you all for your insightful contributions. And this concludes our sweet and short panel discussion.
Yes, I think this topic is very close to my heart, so it was great. Yeah, thank you.
Thank you very much for this panel on diabetes insight. Thank you. Thank you very much.